We are at 10 o'clock, everyone. Good morning. Thanks for being here today. Welcome to the 2017 Eau Claire Regional Practice Sessions. We are at 10, and we have two more people that we're waiting for. So maybe we'll get going because it's just two of them. And then we'll let everyone go.
Isn't coming.
Rebecca is not
Yeah,
coming.
I should have mentioned it.
Okay. And I think she might have emailed me too. So thanks for mentioning that. So perhaps we, just in the essence of time, we'll start everything. How's everyone doing this morning?
Yeah.
Good. Good. Okay. Did anyone have a really awesome drive this morning into Eau Claire?
Right.
Yeah, those leaves are beautiful.
Yeah. They're not changing yet in Madison. They're like hardly changing. So Amanda and I, when we were driving up this morning, we're like, look over there, look over there. So I had a pretty awesome drive. It's really exciting to see all the colors because, again, we don't have colors yet. So I get really excited about that. Okay. So everyone, why don't we take out our folders first and just go over what we have in here today. On the, let's see, left side, we have our agenda for today, the welcome presentation, which is just us kind of getting updates for this year. And then we have model release, evaluation, and then on the other side are our presentations for today. So this morning, we'll have Angie Weidman. We have one Chippewa County. Looking at you, Christina.
I'm Christina. Angie Weidman.
Yes, Angie Weidman. Thank you. I didn't want to say Weidman. Weidman. She's coming in here today.
Oh, okay.
She is. So she's joining us. I'm sorry, I didn't want to surprise you.
No, it's okay.
Angie Weidman.
Yeah.
Okay, thank you. That's what I needed confirmation of. Is how to say her last name. Angie Weidman is going to join us this morning. For her trauma-informed care and how to incorporate that mindset into current practices. And then we'll have lunch at noon, and we're having lunch from Panera, right? So I believe Rebecca was the only one that had a gluten dietary restriction. Did anyone else? Veggie, gluten? No? Okay, she was the only one. So everything has been taken care of, but we're having Panera for lunch at noon. And then I'll be leading our Improving Resilience training in the afternoon. So that is our schedule for today. And our objectives are really just to go over what is trauma and trauma-informed care and how can we use that mindset, incorporate into our current practices and improve the conversations, relationships that we have with moms, and how this can help your moms be more successful when we use the trauma-informed care mindset. And then really looking at resilience, because we know for anyone that has experienced any adversity, the best way for them to be successful in life is to be resilient and continue to actively work on their resilience. So we'll look at that in the afternoon. And just a few housekeeping things. I know that we're all at work while we're still here. So if you have any extra work phones that you need to be keeping watch of, please do that. Take care of whatever you need to. If you need to step out and get to a client that you've been waiting for a phone call from, please do that. And then if you want to, rings are fine with me. Sometimes buzzers better. It's up to you. Bathrooms are down through the door and straight ahead. Everyone's used the bathroom, knows where it is. Okay, perfect. Lunch, again, we're having at noon, Panera. And before that, before we get any spills or anything on our faces, any spinach in our teeth, we're going to take a group picture, which we all love group pictures. So again, please sign the model release saying it's okay that we take some pictures today. And everyone has signed in. Everyone has a name tag. Right now, everyone has a folder and a pen. You're good. All right. So because we are a small group, let's go through today and do some introductions. So who you are, where you came from today, and what your role is in First Breath, my baby and me programming. and maybe something that you're excited about today.
Bev,
Bev,
I'll start. My name's Bev. I'm a nurse here at the Oakland Health Department, and I'm part of the prenatal care coordination and healthy beginnings clinic, and so that's where I administer first breath with Rosemary. And I'm also the lead. Thank you, Ellen. I'm also the lead here for first breath in my baby and baby program. I'm excited about learning more about how to instill resiliency in women. I feel like I've learned a lot about trauma-informed care, but how to really instill that resiliency and help women get through it is what I'm looking forward to.
My name's Ellen. I also work here in the health department. I used to be the lead before I took over these programs, but I do lead our Healthy Beginnings Plus, our prenatal care coordination program. There's no longer in place. I don't know, I just always enjoy these trainings. I feel like they come away invigorated with new ideas.
Thanks for being here.
I'm Christina from Chippewa County. I public health nurse is the lead in PNCC and first breath for a smaller group. So I do both of those, and I didn't know Angie was coming, and I don't want to talk about too much, but she's a really interesting person, so I'm excited.
Right.
No one told me anything.
I've only ever emailed and like have had phone conversations with her, but she really is. I mean, just preparing her bio, she's done so much stuff.
You know.
And I don't want to speak to age or anything, but she looks really young. So I'm like, how did you do all this and you look still so young? So she has just a lot of experience in different avenues of health and healthcare education. So it's really interesting.
Mindy Burns, I'm one of the public health nurses in Clark County. And we do this through our PNCC or Healthy Beginnings Plus program as well, the first breath and baby need. And that's kind of what you were saying, just about being able to help women learn how to find that resilience in their strengths they already have to help them with that.
Great. Thanks for being here.
Kathy Frederickson, St. Clair County. I'm not young, and I don't look young. I've been doing first breath along with PNCC, Healthy Beginnings Plus, as long as it's, almost as long as it's existed. We are doing the ACE screening
Oh, you are?
at our Health and Human Services. It's trying to be trauma-informed,
Okay.
and so we do the ACE screen on nearly everyone. It's pretty hard when they speak Spanish, yeah, I'm sure.
Right.
It's difficult. But I wanted to learn more about how
Yeah.
to then just get them to counseling.
Mm-hmm. Right. That's so exciting, Kathy.
I'm Sally Johnson, public health nurse from Polk County. Work with PNCC and first breath. And I'm passionate about the first breath tobacco program. And I always become energized after these meetings. So I appreciate that.
Diane Robertson, I'm from Dunn County, and I am one of the beginning supervisors in Nurse Family Partnership. And that started a little over a year ago, and we did the original training for first breath a little over a year ago, and have totally dropped first breath and are looking to reinvigorate it.
Mm-hmm. Thanks for being here.
Hi, I'm Danielle Miller. I'm from the Wood County Health Department, and I'm a public health nurse there that is PNCC. And we'll be first breath within PNCC and also our WIC program. And we've done a lot of ACE training within our health department, so it's really nice to see how we can incorporate it with first breath.
Great. I'm Terry, I'm a patient care coordinator with Group Health Cooperative. I talk more quite often. I can call you at a meeting to call you about the survey, about the pilot, because the online site wasn't working. I will call you.
No worries.
I help the members with the first breath, and it's been very successful. The members are excited about it. It's really been helpful for them. And they've actually had me participate in the pilot survey, pilot program rather, kind of revamping the first breath, and that's been exciting. And actually, Group Health is implementing projects as of January 1st on how to connect more members, how they have more access to us, and how we can remind them of things that are going on in their lives personally, so that's exciting.
Thank you for being here. So, as you mentioned, we do have some exciting stuff going on with First Breath, but I'm really excited to hear about those of you who are working with ACEs already, and raise of hands for those of you who have already like learned about ACEs, have had an overview, familiar, okay. Perfect. So I'm excited to have this discussion today and get everyone talking about what you're currently doing, what's working, what you're finding out, what you like about it, or just sharing ideas is sometimes really, really helpful, I think, when you're in the same practice, to hear what one person's doing and maybe tailor then what you're doing to utilize what they're doing. So, because why reinvent the wheel if someone's already doing it and it's working well, right? Thank you for introducing yourselves.
I'm just gonna say,
Yes.
if you have an opportunity to see the movie Paper Tigers,
Yes.
that was my first exposure to it. It was held up in Rice Lake, and my daughter and I go together to see that. And it's amazing. I think it may be on YouTube now, I'm not sure.
So
The Walla Walla, Washington, how they changed the whole school attitude about children, the students' behaviors, and they went back to find that these were all related to trauma that had occurred in their lives, and how they just changed the whole school. It's very well done.
right. And were you present at the state reunion, Kathy?
No.
Okay. And I know there was like a really bad weather, we were having a big storm that day too, so I know a lot of people couldn't come. But Robin Mathias, who came and spoke on ACEs and trauma-informed care and brought up a little bit of resilience, just as a nice overview and awareness presentation, she had shown a really great video that incorporated, it was from Paper Tigers and then one other documentary, and they kind of merged all that information into a really nice, like 2.5-minute preview. So I'm familiar with Paper Tigers because of that, but I actually haven't watched the video. How long? Is that like a full documentary?
It's like a full documentary, yeah.
Perfect. Okay. Cool. Paper Tigers, everyone.
They had
You
shown
can
it
watch
at the Rice Lake High School or something, and I heard about it and so we get up there and call. So it's being shown somewhere, you know.
Great.
I
Yeah, absolutely. So thank you for sharing that. Again, I love discussion. It's perfect. As a snapshot for First Breath and what's been going on so far this year, we have 13 new sites offering First Breath services, and then in total 158 current sites offering services, which is really exciting, and then still over 1,000 trained providers that are talking to women or trained to talk to women about their tobacco use during their perinatal period. And then as far as participation goes, we have enrolled, and I pulled this number in mid-September, so this is not exactly up to date. We're probably a little bit closer to 750 or even more. But 710 women enrolled in services, which is pretty exciting. And of those, we're still seeing extremely positive outcomes. So 85% of women having success, whether that's being able to completely quit and stay quit, or just significantly reducing. So, and that's not at all the work that I'm doing, that's completely the work that you're doing. So, great work. I'm very appreciative, and I'm pretty sure that their families and themselves, they're also proud of themselves and the work that you're doing. So, thank you. So, moving forward, as Terry had mentioned, Eau Claire County and then Wood County mentioned maybe briefly that they have been doing something a little bit different this year. And we have a pretty big and exciting announcement to make about First Breath programming moving forward. It's something to jump for joy. We're jumping. This is a really fun depiction of the fact that I am not and never have been a cheerleader. You can see I'm the one on furthest to the right. They said jump, and I said, yeah, I'm jumping. And the person taking the picture is like, no, like get off the ground. I'm like, okay, sorry. You can see the other my two other coworkers were cheerleaders in high school, so they know how to like kick and jump. And yeah, so we're jumping for joy for this new exciting news. Also, we're selling these umbrellas. So if you want an umbrella, you can make a donation to the foundation. Just a cheap way for us to, sell some umbrellas. But really, jumping for joy because we're really excited. So can I get a drum roll for this big announcement? Okay, so you spoke, participants spoke, and we listened. So what is going on? Over the past 5 years, we have been asking our providers in an annual survey, what are your thoughts about First Breath? How are things going for you? How do you implement this program? And what are your thoughts for improvement? Or what would you like to see in the next few years? Also, in the past few years, we've had discussions during our regional practice session meetings. If you remember last year with Chrissy, we discussed some of the results from Striving to Quit and what we're really excited about in that programming and offering services to support people. And then at the statewide meeting, we had our walkabout with Chrissy again. She's just really good at facilitating those discussions. But again, we talked again about what are you doing in implementation, what do you like, what can we improve on. And the patterns that we've seen are that you as providers want something that's simpler, less time consuming. I know that we give you at least 3 points of data collection. So you have enrollment, which has 3 forms, a prenatal visit, a postpartum, and that can be a lot sometimes, especially for our folks that are in a clinic setting. And even those that are working in WIC and PNCC, you still have a lot more information to go over than just tobacco. So what can we do to simplify this for you? A lot of people said they wanted it to be more directive, so what can I do at each visit? What are the things that I should go over? So it's kind of like a mindless process where I go in and I'm very strategic with the time that I have with mom, especially because you do have so many things to talk about. Also, going off of Striving to Quit, First Breath Families, and the services that we had in this area 2 years ago with Amanda Brendan. Does anyone remember that? Do we call it First Breath Families too, or did we have a different name for it? Okay, so we're offering postpartum services, but still we want to continue offering services to support people and postpartum because we know there's a high correlation of social support networks having they have a lot of play into how successful mom can be when making changes in tobacco use. So we wanted to continue to offer those services. And then also we want to have access. We want each mom, and what we've heard is providers want moms to have access to a certified tobacco treatment specialist because we know we can't expect every single person to go and become a certified tobacco treatment specialist. And again, because you have so many other things to talk about with mom, really sometimes the hardcore stuff is easier to know that someone else is going to go over that with them. So keeping that in mind of what you had been telling us over the last 5 years, and then talking to participants and asking them, from the services you've received, what do you like? What would you like to see more of? And over, again, the past 6+ years, we've done Striving to Quit and different variations of First Breath Families, and that has always been very dependent on different funding. So instead of just being able to offer services in different patches of the state, how can we make this available to everyone? So everyone can have the postpartum services, everyone can have a support person included. How do we do that? We did that, or we found all that information from First Breath Families, Striving to Quit, and then holding different meetings and groups, I guess qualitative focus groups with participants and asking them, what do you like about our handouts? What don't you like about our handouts? What do you like about this wording when we're giving you some scripting for First Breath visits? What do you like? What don't you like? And what do you wish providers would talk about more? So what we found is that they really like the intensive support throughout their pregnancy. And if anything, they feel like they could use a little bit more. So not only the visits that they have with you, which is extremely important to continue to have that person that's a positive touch in their life, but then also, the texting services, being able to go on Facebook and get positive support from our First Breath Facebook page, but then they also wanted something additional, someone that would be calling them and they could reach out to even if they didn't have a visit. So something a little bit more impromptu. They also wanted more focus on stress management and coping skills, which of course makes sense. Most moms, I think we can agree, they say, I can't quit because I'm so stressed. Is everyone shaking their head? You've heard that a few times at least. I'm so stressed I can't quit smoking. So they want more focus on that. And then coping skills, which we'll find out today is really important, especially for those who have experienced trauma, and incorporating more positive coping skills into their behavior change. And then the family and partner involvement. They agreed that, you know, in my social network, if I don't have positive people, or if I don't have people who are making this change or supporting me through it, then I'm going to be less successful. So we did something about it. We heard everyone say, you know, this is what we want, so we did something. And this year, our first step was to pilot a new model to try to include all of these requests and what I think are important improvements to our programming, where we rolled out a streamlined version of First Breath. And we had Wood County and Group Health Cooperative and Eau Claire and, I'm getting everyone right? Okay. So we had you guys involved in doing this new implementation, which was a little bit extra work, so thank you guys for cooperating and working through all of the little, you know, bugs here and there, and for figuring out the fancy footwork of rolling out something that's new. I appreciate all the extra coordination and communication. But we did that with a quit coach. So Amanda Brendan has actually been a part of this new model just for our pilot, and she's right there. Yeah, Amanda. So what our pilots have been doing are using just one form to complete, you know, a brief baseline and then share communication and contact information to then be sent into the foundation, and then we pull a list of names for Amanda to call each week, and then she'll call them and reach out and offer that additional intensive counseling that they may be needing. And so far, we've had extremely positive results. 50% of participants are smoke-free at their postpartum call, which happens 3 months after they've given birth. So 50% are smoke-free. That's incredible, incredible. And then 100% of our pilot sites have said that they enjoy this new model. So we're really excited that things have been going well and that everyone's been really willing to work with us through all of these changes. So I appreciate that. So now that we've had our model and our pilot and it's been going well, we've tested it out, what we want to do next is roll these Streamline services out so that everyone can have the access to these services. Like I mentioned, we could really only do the postpartum and intensive counseling when we had funding, and we recently got some better funding, and we can now make this statewide, which is so exciting. So really, what's the same? The core of First Breath is still the same. We still want our First Breath providers to be engaged and intervening, having counseling chats and checking in with their First Breath moms. But it also it takes a little bit of the burden of data collection and all that off of your shoulders, because you do have a key role in identifying women that have a history of tobacco use or currently smoking, and getting that first touch with them and then engaging them in this behavior change. But we still want to make this as doable for you as possible. So what's going to be changing? Again, this is statewide, which we're excited about. One form. I'm going to say it one more time. One form. Who likes paperwork? No one? Okay, no one likes paperwork. Okay, good. So it won't be a big deal if I'm taking it away. Just one form. That's all we're asking now. We'll be giving you, again, updated materials for using with clients and education. You can see I brought with us today some extra handouts, and I'll go over those today too, but we're going to continue to use information that we've received from participants and use their feedback to continue to tailor our educational materials that we give you, because we found better results when we ask the participants what they want to hear. And then we're also going to make all trainings, try to keep those a little bit more simplified and accessible to everyone. And then have that access to a quick coach like Amanda. And just to give you a brief sneak peek, because you all are very lucky to be here and getting, and being here today, you're the first ones to know that we're doing this, this big improvement in our programming. So this is in your folder, but just to give you a sneak peek, this is what things will look like. However, looking forward, really details are going to be coming next month. My plans are to reach out to each and every one of my main contacts for each First Breath site and really go over all details of programming and what it'll look like in 2018. So I'll be contacting you, each of you, over the phone, and then just all First Breath providers will be getting an email from me, just still giving the same detail, but just it'd be impossible to call over 1,000 people in 1 month. That's a lot. So I'm going to send out emails to everyone and then call our main contacts. But then following that, we're going to have our new training available December 1st, and it'll be online training too, so you won't have to make an extra trip or anything like that. So December 1st is when we're going to launch that new training, and we ask that in the month of December that everyone completes that training so that you're on board for 2018. All right. Any questions? I do want to keep on going because we're getting close to our first session. So good morning. Hi. Thanks for coming, Kathy. There is one spot. Oh no. Sorry. It's okay. I want my Kathy to sit up here. Okay. That's all right.
Sorry.
So what's up with my baby and me this year? Things are still moving along. We had just 2 new sites this year, and that makes us up to 81 total My Baby and Me sites, and nearly 250 trained providers in My Baby and Me, and offering alcohol screening and education to women. Within this year, who has received services, there's over 1,500 women have been screened for alcohol use prenatally, which is fantastic. It's really, the goal of My Baby and Me is not only to prevent fetal alcohol spectrum disorders, but also to offer that assistance. So with that, 316 women have been referred to services, and 88% have been screened and offered that FASD prevention messaging, which is huge. We're really excited about that. I don't want to have any questions like in 5 years, like what is okay? Drinking is okay, just red wine. I hear beer still, those are good minerals for me. In 5 years, I'm hoping that is gone. With My Baby and Me, let's hope that everyone is educated on what is okay with alcohol use in pregnancy. So, it's My Baby and Me, and then events looking forward. We have a webinar coming up in November, where we're going to bring together some of our tobacco coalition leaders and talk about what their efforts are this year and ways for individuals in different areas to get engaged and connected with their local resources. And then can everyone save the date? Now we've shared this in the e-newsletter, but just to again bring this up and save the date, our statewide meeting is Thursday, March 8th, and that'll be in Johnson Creek, where it's in between Milwaukee and Madison. And there is a outlet mall in Johnson Creek. So that is the extra benefit of coming to Johnson Creek. Yes. And registration is free, but however, it's not open yet because it's in March. We'll probably open that up in December or January. Just, we're always planning like a year ahead of things, so keep that on the radar. All right. And also, so one last update, we are hiring. As we're moving forward with these new exciting improvements in our programming, we need another quit coach health educator, right? Is that what we're calling it, Amanda? Okay, quit coach health educator. Thank you.
There'll be
Thank you. yes, maternal child health educator. So we're looking for one more person to add to our team in the northern part of Wisconsin. If you know anyone that you think would be a really great fit for talking to moms about their tobacco use and counseling them over the phone, meeting with them too, in the northern part of Wisconsin, please refer them to us. Send them to our webpage. We're hiring. We're excited to be hiring, and we want to find someone really good, and we trust you. We think that you know a lot of really awesome people too.
You want these people to have previously been smokers?
You know what? If they have been, that's completely fine. We're really flexible with anything. If any, I mean, it is helpful to have previous smokers on the team too. Anyone, Amanda?
And we will be getting them trained as a tobacco
Yes.
treatment specialist.
So that is
once they're hired.
Mm-hmm. So if you know someone, you're like, oh, they're a really good fit, but I'm not really sure if they're qualified, they don't have their CTTS, that's okay, we will train them. Okay, very exciting. Anything else you want to add to that? You're kind of on the
How far
committee.
northern is northern?
All the way up to the UP. You stop at the UP.
Really, we're looking for someone in the Hayward,
Rhinelander.
Ride, and like the Rhinelander area would be preferable. Because right now I'm traveling that far, and we're going to have a lot more women to be servicing.
Mhm.
So if we can get someone in Rhinelander, we can take over the area counties.
It is a full-time.
Almost.
Full time. Thank you.
For no benefits.
Was it
I think
People will ask.
I think it's probably in the job description online, and I actually have the job description with me. If you'd like to share that, Kathy. Does anyone else want a copy of the job description? It's $15.25 hours, but I believe that will probably increase.
I think that could be flexible, you know. We're not sure how many women are going to be receiving services. We're hoping a lot of them, and then that would probably make that a full-time, close to full-time.
Oh,
If any of you are willing to move to the right.
anyone wanting to move further up north? You know, Ashland is beautiful, but
Those Rhinelander.
so is Rhinelander.
You said something about telephone, but this is face-to-face. It would be both. It would be intense tobacco cessation counseling, a lot of home visits, and some phone connections as well. We've had a lot of success with the home visiting.
Yes, we have. All right. So thank you again for being here this morning. This is our welcome. And now we're going to send off